we've done so far, but probably since about April or so when COVID started hitting. Good to see everyone. I see some of our staff, our members here, patients, and others. Thank you so much for all coming here during your lunchtime and spending time with us today. Today we have a very special guest, Jessica Kaylor, who's a physician assistant and dermatology expert, and she's gotten into integrative and functional dermatology, which is really interesting because not that many people, I was just talking with her before this webinar, not that many people are actually expert in that. So love to, thank you so much, Jessica, for coming on today. We are going to be going into CAH community updates for just a minute, and then we'll go to dermatology. So for our clinic, as some of you may know, we are back open for in-person visits since May or June, I think is when we started. So we're doing in-person visits here. We obviously are also doing telehealth. We're doing our procedures that we do here, lab work, and also intravenous nutrition. We do have mercury-free flu shots here. We had them. We have them on wait lists now because I guess there was a rush on them. So we are recommending people go to the pharmacy for flu shots. And if you do get a flu shot, we typically recommend or think about getting probiotics, doing IV nutrition, etc. During that time. We have new practitioners that are starting, one of which I think, let's see, Stephanie's on the call here. Let me just see. Welcome to Stephanie. Stephanie's been here for a couple of weeks now. She's our new nurse practitioner, so welcome to her. And I think Araceli also is on here. So welcome also to Araceli. Araceli's been training with me for over a year. Both of them have been amazing. Araceli is a RD, registered dietitian, and a certified nutrition specialist, and she is trained in functional medicine. Like Jessica's also training that as well by the IFM. And so, and then we have some group visits that are really interesting to be a better service to you here, part of the community. We have health coaching with Tony St. Clair Fish. We have heart math with Liz Reese, and we have special topics, including, which I'll talk about in the next slide. Vaccines, not holding out hope right away for a vaccine. We always know that despite if a vaccine, if and when it does come, and if it's effective, which might come in late 2020, and there's a link here, you can read that if you'd like, to mid 2021, we have to take charge of our own health and optimize our own immune systems. And one of the ways we can do that is to look at our skin. Our skin is actually one of the biggest, it's our biggest organ actually, and it's really can tell us a lot about our immune system and general health. And just so you know, just to reemphasize again, we are committed to continue our mission of leading, inspiring, educating, and serving our community to do our part to create a healthier society for everyone. And of course, part of that is taking responsibility for your own health here, but we are partners with you. So part of that we're doing is we're doing these virtual group visits so that we can kind of get ahead of the game, so to speak, with regards to our health. How do we optimize hormones? How do we optimize our adrenal hormones, thyroid hormone, and estrogen and testosterone? And we can see how that may interplay today with dermatology as well. That is a virtual group visit. That is Tuesday, November 17th from 4 to 5:30 p.m. You can message CIA inbox if you're interested, and we'll get that over to Wendell so he can help you with that. Oh, thank you so much. All right, thank you, Michelle. I think Tony, did you want to chat? I think Tony had something to say possibly. Hey, Tony.
Hey, hello.
How are you?
I'm great.
Can we see your face? I don't know. Tony's our health coach here at CIH, just in case.
I'm kind of wandering around the house, so it's probably not a good idea. But yeah, I'm sorry. What would you like me to talk about?
Oh, you had raised your hand. I didn't know if you want to talk about.
You know what? I probably hit it accidentally. Carry on.
That's okay. Nice to hear your voice, and hope you're doing okay at your house. We'll talk later. Talk to you later. So here's our November schedule. Jessica's on today, so glad to have you on, Jessica, for Integrative Dermatology and Functional Dermatology. Dr. Viral Sheth, who is a graduate of the GW Integrative Health Graduate Program, is going to be talking next week about integrative cardiology. Dr. Liz Lipsky, who is an IFM faculty member, is coming on in 2 weeks on digestive wellness, which would be, both of those would be really great as well. And then on Thursday, the 26th, we have a break for Thanksgiving, so we can all enjoy that. So with that being said, I think the first thing we want to talk about is which conditions that do you want to hear about the most in regards to dermatology, in regards to skin health. So it's multiple choice. You can choose, one or more of these, multiple choice. I think, so we have acne, eczema, psoriasis, rosacea, dry skin, vitiligo, and then other. So you can do your write-in ballots. I have to make some election jokes here. Let's see, fungal. Okay, so someone's saying fungal issues. Thank you. Thanks, Robin. Everything. Stephanie said all conditions. Yes, we'll try to get to all of those conditions. Let's see, who else? Hair loss. Yes, we're definitely gonna, that's good. I want to hear about all these too. Hormonal acne around the chin. So we'll have some Q&A. We'll do that. Hydradenitis. Okay, so that was interesting. Thank you. Acne from mask acne. So eczema was the winner here, but they all got votes. So we don't do an electoral college here. We address all aspects, I think, here. Okay, so I'm gonna go to the next thing. Yes, we will have a recording later, Nicole. Thank you. So here's just an outline, and then I'll go to, then we'll stop the screen share. We'll introduce Jessica. But first I want to introduce Jessica. Let me see. We'll go back to that. So Jessica is a graduate of University of Pennsylvania, where she played on a championship field hockey team. She got interested in medicine and went to Georgetown for her pre-med studies, and then went on to Wake Forest for her PA for MMS degree. And then from there went to a practice in New Jersey. So she now sees patients in New Jersey, New York, and Pittsburgh as well. And I think is one of the few integrative dermatology providers out there who actually looks at the root cause of why someone might be having skin conditions. That is really where, so interested in hearing what Jessica has to say. So again, thank you, Jessica, for coming on here. We do want to just give you an outline of some of the things that we can talk about. But I think what I'll do is I'll probably go to just, and you can see kind of here, but what I'll do is I'll stop the share right now so we can actually, okay, so we're recording, so I think we're good. Let me see if I can, okay, there we go. All right, I think so. So Jessica, I'll take it away here for integrative dermatology. Thank you so much.
Sure. So should we start with eczema?
I think eczema seems like the top vote getter, so definitely that. A couple people said HS, hidradenitis suppurativa, as well. But yeah, definitely eczema. Acne seem to get a lot of votes too. Let's start with eczema. And first of all, what is eczema? I think there's a confusion sometimes between eczema, dermatitis, different things.
Yeah, well, actually, it's funny when people say the word dermatitis as a, I think that patients often just want a label. They want to know what's going on. They want to know, have an answer. So sometimes they come in and they say, I've been told I have dermatitis. And I kind of chuckle because, dermatitis just means that your skin's inflamed, which we know.
Inflamed, yeah.
So like itis of the skin. So there's many different types of dermatitis. So eczema is atopic dermatitis. And that atopic word refers to, like, there's an atopic profile that can happen. So atopy can involve eczema, allergies, and hay fever. So it's that you have elevated IgE in the blood. So the person has a constellation of symptoms. And that's really how I was trained. To kind of stops there, the speech. You might need an allergist, you might need, an antihistamine, you might need to see, an allergy specialist. So I think that integumentary system, embryologically, the gut and the skin are very connected, if not, synonymous. So gut and diet comes up like in almost all of my
I've
visits.
never had anyone tell me in terms of patients, and maybe if patients are on here or anyone's on here that has ever been to a dermatologist, I haven't ever had a dermatologist ever comment, hey, there's a dietary issue going on. What's the root cause? You know, it's really more about sort of the Band-Aid approach, as we were talking about earlier before this call.
Yeah. Yeah. So I would say that like the whole list, almost all of it, I take a really strong approach with diet and gut health. I started with baby steps before I even started with functional medicine. If I ever needed to use an antibiotic, I was prescribing a probiotic to fight that dysbiosis and killing the good bacteria.
Yeah,
And
I did that too in the hospital medicine. I was like, well, I'm giving someone IV antibiotics, but at least I can give them a little bit of saccharomycin or something.
And I'd have them continue it for 6 months. But for eczema specifically, I mean, you know, you do have to address like the barrier issue. So, you know, at the skin target level, you know, my big spiel is like avoid hot water. A lot of times, like if patients just stop taking hot showers, you can get rashes to go away. Or conversely, you can have a topical steroid for a month and it's just not budging and you realize that they're taking hot showers. So
hot, because let's talk about that, because I take hot showers and I think I'm going to try to do some hot cold kind of action there. But what is it about the heat that is potentially damaging to the skin or irritating to the skin?
It just really dries it out. So if somebody has a barrier, so the atopic profile can make you more reactive to things. So you can react to, you know, especially dairy. And I would say gluten would be next for, but I would say dairy is number one.
Dairy number one, gluten number two. Okay.
Yeah. And so if you take a hot shower, it's just, you know, we have to get to the level of the skin, their barrier doesn't work. So like there's a systemic, you know, responsiveness or a systemic sensitivity to foods and other allergens. So it could be environmental allergies, and then the IgE goes up and the skin is more reactive.
So would you say that allergies or gut issues can cause what's called like a leaky skin barrier? Is it kind of like leaky skin the way you would think about for gut?
You know, if you're ingesting gluten and you have any sort of sensitivity, and then that I always tell, you know, patients, your gut is one cell membrane thick, and you know, if you take the zonulin from the gluten and it starts to make those junctions leaky, and then re-inflames the gut, and then food gets into your bloodstream, and then you have systemic inflammation, and so you might be getting rashes that don't make sense, or it could be something environmental. It can be somewhat of like a detective game, especially if it's contact dermatitis, meaning like you get into contact with something you're allergic to. But I think there's two different avenues that I go, because if it just looks like they're inflamed head to toe, and we can't just put like a cream, you know, head to toe.
It's not going to work.
What's going on with the diet, but also what's going on with like the processes, like hot showers, moisturizing. Those are the big ones that I definitely address. So sometimes people, like in the winter especially, they want to like turn the shower as hot as possible and
crank it up. Okay.
Sometimes I tell them, you know, just turn it down. Like, you know, the difference between hot and warm. You know, if you really fry the moisture out of your skin, we're never going to get you better.
So I'm definitely a neophyte on moisturizer and general skin health. So I'm going to ask you some basic questions. How do you keep your skin healthy? When's the best time to do moisturizer? Someone asked, is moisturizer good or bad? Those type of things.
So moisturizer, your skin's kind of like a sponge. So when it's wet, whether you're washing your face, doing a facial skin regimen, or showering, I always tell people, like when you wash your hands, like let's say you're out at a restaurant and you go to like the dryer, you know, there's that time between when they're still moist and when they're fully dry. That's when you have to moisturize and lock in the moisture. So if you wait too long, you're already too dry. So another common question I get is like, what order do you want to put products on your face? And it really doesn't matter. They've done studies, because the skin is absorbing things when it's still moist, but you want to lock in the moisture before your skin's dry. So, I mean, I think it's tough to find things that are completely clean. So I use like the environmental working group website to like check. But I think that, again, if you get to the root cause of what's causing the problems, that's healthier than sometimes we do need to use things, or even topical steroids, or I really try to avoid oral medicine as much as possible. But, you know, Aquaphor, I think, is rated like a 2. And I love some prescription moisturizers, but God knows what they'd be rated, because they're not over the counter. But sometimes that's what you need just to get things under control.
Right. So for everyone that doesn't know, that's Environmental Working Group, ewg.org/skin deep. And that's the website to go to for cosmetics, for skincare products, for shampoos. I think they have toothpaste on there maybe, but all these products, I'm not sure about toothpaste, but they basically from 0 to 10, I believe 0 to 2 or 0 to 3 is considered low risk in terms of environmental chemicals that might harm your skin and your body. Yeah, and I think skin is interesting because it's almost like you have to address the internal, but also the skin is also an internal and an external organ, right? I mean, it's like external, but it's also internal. So it's almost like leaky gut, leaky skin, you know, and you get to address both almost like simultaneously.
I'm starting to see the gut and the skin is pretty, you know, synonymous, which I don't have a lot of buddies in my crowd on that, so it's kind of forging a new
we've seen rosacea, other quote unquote dermatitis get better with gut treatments, you know. Now
dysbiosis is rosacea and acne for sure.
And acne. So would you recommend treating the gut and the skin simultaneously? Is the skin going to get better? Sometimes it doesn't get better only with gut treatment, you know, there has to be some skin treatment too. What do you recommend for that?
You don't want to have them like, you know, because cleaning up the gut can take some time, and it can be a process. So you want to give them some symptomatic relief because, you know, they want the acne gone yesterday, of course.
Right.
Want them to have like marks or scars. So I definitely agree, like how I was trained with. And
what is a holistic treatment topically for acne, or not holistic, but you know, holistic / integrative / functional, I guess.
So the treatment side of things is the most challenging part to be holistic. So sometimes we just have to compromise trying to be as clean and holistic as possible with, you know, trying to get things clear. So I like sulfur and sulfacetamide based products.
Okay.
I think sulfur for sensitive skin or for inflamed skin is amazing. I also find I've been kind of, sometimes people get like bumps on their buttocks or on their butt, and I am suspecting that there might be some sort of parasite correlation.
That's interesting.
Because I've throughout my career of 10 years in treatment in dermatology, there's always this kind of like butt acne that just doesn't really
go away.
It doesn't
the crazy thing is there's research that shows that 50% of people have H. pylori, 80% of people have parasites, and some of those can cause gut dysbiosis. Certainly we know parasites can cause IgE-mediated things like atopic dermatitis, like eczema. So we have been starting to do more parasite protocols here, and it seems like that has been really helpful for the skin.
So, and the gut is so essential. But to answer your question, I mean, I think it really depends on the motivation of the patient. I know that your audience is very motivated, and that's so helpful. I had a recent patient where we just did a full elimination diet of all added sugar, all gluten and dairy, and he had a lot of improvement to make. And it's on my Instagram. He cleared better than what typically like a 3-month course of, because typically in dermatology, the way that I'm trained is oral antibiotics. And what I found when I really put that into practice was that if someone was severe enough that they had moderate to severe cystic acne, they needed 3 months of an oral antibiotic consistently. If they weren't consistent, we'd have to start over again. That was just
so you need to just have it straight like that.
Like if you miss a day or a couple of days or certainly a week of the medicine, we're gonna have to start all over again. And he improved better than what I usually typically saw with 3 months of an antibiotics. So that was super exciting.
With dietary and nutrition elimination diet type, or gluten dairy, it sounds like gluten dairy sugar.
Very added sugar because you know the P. acnes, the bacteria feeds on sugar, and also of course affects hormones and that kind of thing, and bacteria biosis. So, and then of course acne. So it was really cool because he cheated once. He has this really favorite like fried chicken sandwich that he likes to get. That he was
it,
And he said that he had 2 bumps. It's on my Instagram. He had 2 bumps that he said were correlated to that cheat. So. Really exciting because once you join the integrative group across town and start really like digging into people's guts, I think that it's really going to be very effective and so I mean, you're going to make such an impact, because if
Yeah.
you're giving antibiotics, you're actually making the root cause worse.
Yeah, Judith had a really funny comment here. Thanks, Judith. She said, try and get a teenager to stop eating sugar and junk food. However, maybe, Judith, the teenager, if they have acne, then maybe that's the way to convince them
Yeah,
to,
and that's the thing, it's integrative.
That's
So,
good.
I've had patients say, I'm just absolutely not going to do that. And I've negotiated, okay, well, can we just do not do cereal every day? And then, they say no, and they come back and they haven't had cereal in a month and they look better. And so,
yeah,
it's a negotiation. I mean, if there's somebody who's just not into this, I can revert to like the conventional,
right.
treatments.
Antibiotics and things.
Topical treatments too. I mean,
Right.
It really has to be big, deep bumps that stick around for at least a couple of days or a week, at least once to several times a month, for me to really feel like oral medicine is necessary.
Got it. I have a couple questions about acne. So I'm learning functional medicine about the pathway of the 5-alpha reductase and the testosterone to DHT. I'm wondering if you've ever found saw palmetto or some other 5-alpha reductase. We know it's good for hair loss, hair issues, but have you ever found it to be good for acne? That, and also the role of healthy fats with acne.
Okay, so in terms of like hormones, I find that I typically at this point still refer to like hormone experts.
Experts, yeah.
Hormones can be a lot.
They're tricky, yeah.
Yeah, they're very tricky. And I'm actually, the regenerative medicine group that I'm joining, she's a hormone expert. So I am excited how she's going to help me integrate hormone treatment into acne. But I do feel like it's very gut specific. I find that like, patients come in and they say, I have hormonal acne. And I'm like, well, all acne's hormonal, like kids are going through puberty and like their hormones are affecting their skin. And, it doesn't mean that there's something wrong with your hormones necessarily. It might be how you're reacting to those triggers because you're inflamed. I think it's all.
And I've talked to hormone experts about this as well. And sometimes the gut, actually back to the gut again, can cause those hormone imbalances. That's the thing about there.
I think it's all gut. I really do.
Gut. Evelyn asked about, thanks Evelyn for the question too, about backne. I guess that means acne on your back, I'm assuming.
Yeah. There was a second part to your question.
Just about healthy fats. I think that's a good question for the skin, right? We know that skin, there's a lot of fats in the skin, right? Can you just kind of go into that, some of the basic aspects of, there's some fats and oils in the skin, and how does healthy fats in the diet affect the skin?
Again, I think if it's good for the gut, I think that it's good for the skin. There's never been any studies to my knowledge that say that like what you ingest makes it to the end stage target tissue of the skin. But I find that if you have systemic inflammation, that's what ends up showing up on the skin. So you do have like on the layer of the skin, you have to take care of the tissue in terms of like the barrier. And, if it's too, like with acne, if it's too dry, you can break out from the inflammation of being dry. So you have gut root cause inflammation and then target tissue inflammation.
Yeah.
So in terms of healthy fats, I mean, I try to push that to enable the patient to be satiated by meals so that they're not going to reach for the sugary, carbohydrate
at the end of the meal. Right. Yeah.
So I try to tell them like have like one healthy fat, per meal. And then depending, especially if I see that there is some sort of hormonal or PCOS or mediated issue, I do recommend intermittent fasting.
Intermittent fasting, yeah, that's great. I'm doing a little bit of that myself.
And that's really, if we don't get to hidradenitis suppurativa, that's what hidradenitis suppurativa is, a horrifying, horrible condition that is really, it can be very severe. I saw a girl yesterday. I mean, she's been, mismanaged for a really long time. And, a derm said just threw antibiotics at her and said, take it whenever it shows up until it goes away.
For the rest of her life or something.
Yeah. And it's really, I mean, even in conventional derm, hidradenitis suppurativa is, not to get too into like the minutia, but it's like a cystic acne type eruption that happens typically in the groin area. And it's very related to like insulin resistance. So typically, even like traditional derm, the treatment is like weight loss. but I went over diet, healthy fats for each meal, intermittent fasting, that kind of thing. So I do think that intermittent fasting is how I at least address hormones and insulin resistance.
Yeah. Great. Thank you. I think before, just another basic question is how often should we take showers or baths? You know, is it an everyday thing or skip a day, or what's the best thing for the skin?
I think that there's different arguments, even for face washing. I was just in a functional medicine, conference, and they're like, "Oh, you're ruining your
So
skin."
don't wash your face, basically.
Yeah, you're ruining your
You're ruining your microbiome.
The microbiome of your skin. And it's just like you can really get a little like OCD about this kind of thing.
Yeah.
It's different. I mean, that's how I practice too. Is that everyone is different. So
right.
If you have really oily skin, just like I was saying, if you have inflamed, dry skin, inflammation from dryness, maybe just wash your face at the end of the day.
Okay.
If you have really dry skin, I mean, I find that minimizing bathing does help because you don't want to dry out that barrier, that target tissue. So some people have, like I keep saying, there's the root cause of the inflammation, and then there's taking care of the target tissue, and everyone's target tissue is different. So if you're super dry, hot water is terrible.
Not good. Okay. That's a good.
Is terrible. It just will make it hard. You'll be fighting against trying to get that moisture into the barrier. So
maybe cold showers is good for the vagus nerve as well. So maybe it's good for the skin. Yeah.
It's a good point. And I tell people if they have really trouble with like dry skin head to toe, I also say just focus on the hot spots. So use maybe like a harsher soap in like the underarms, the groin, the feet, and maybe don't like overwash the whole body if you're struggling with dry skin. But back knee, for example, like I wouldn't recommend, you need to probably cleanse it at least daily, probably daily. And I find that actually my just kind of go-to is just like a benzoyl peroxide over the counter, just wash for back.
Counter.
That's most effective. It's a very oil-based problem.
But it sounds like for the patient, for the person with back knee, that maybe the gut's one place to look
Absolutely.
at. I mean, if it's that much,
you had a perfect gut, you probably not have the issue.
Probably not as much.
But you don't want scarring and you want it to get better.
Okay, so we have a few other questions. I want to make sure we're Leomyoma on the breast. Olga asked about Leomyoma on the breast. I'm not sure if that is, I don't know I'm not sure about that.
What is it? I didn't see it.
Could you talk, Jessica, could you talk about Leomyoma on the breast? Is that something? I'd probably refer to a GYN for that. It's probably, I don't know if you can say anything on the derm side.
Leomyoma, I'm actually not familiar with. I mean, it does sound like it's some sort of tumor. It doesn't even sound like it's like a skin tumor.
It's not. Yeah, I mean, I would refer to a GYN, like a OBGYN,
or like a general surgeon or
general surgeon. Yeah, to look at that.
Biopsied and it's like a path result of the skin.
Yeah, maybe if Olga, you could talk more about that. Okay, so then Joseph asked about Milia. Can you address Milia? What is Milia? I guess that's that kind of thing.
So Milia are typically just like little cysts that form on the skin. Some people are prone to them. Patients are always asking me, why do I have this? I'm kind of, why do I have a mole in my face? We just think that I'm prone to them. From what from what I have ever experienced, I've never really felt like there's more like a root cause, holistic cure or cause for Milia. I think it's more of just like, typically it's in people with oily skin. Yeah. To your point, maybe like, oils might feed that, but I don't think that I'd really obsess over that. Right. They look like little whiteheads, just for the audience, if you don't know what Milia are. But they're actually little tiny like cystic sacs that like I get them on my eyelid sometimes. And retinoids, which, are vitamin A derivatives. They're probably not the cleanest things in the world, but we do in derm love them because they help with like fine lines, wrinkles, sun damage, build collagen, build elastin, and it can also turn over the skin and just like clean out the pores and declog. And it really can like work those Milia out. If people hate them, I often just do like a quick cosmetic procedure where I just kind of like pierce them and extract them out like
Okay.
a full.
Would topical, I mean, would oral vitamin A or liquids and things be as good as the topical, or do you need the topical, do you think, to get rid
So
of those?
in traditional dermatology, I mean, vitamin A, oral vitamin A is isotretinoin or Accutane. And,
Right.
waiting for the other shoe to drop on that, because the way I was trained, there was like, no real concern other than some really, really rare adverse effects. But my IFMCP friend, who recently is on a Dutch webinar, she clued me. Apparently it can cause like permanent HPA axis
Oh, wow.
changes. So
I'm talking with Dr. Jones early. We're talking a little bit later with Dr. Jones, so we're gonna ask her about that.
Yeah, but I would think just academically or theoretically that vitamin A, supplementation would always help the skin. But skin loves vitamin A, whether it's like tretinoin, isotretinoin. But you have to be careful about dosage, and you have to be cognizant of adverse effects. But I would say, Milia, honestly, if they're not severe, I would go for extraction with a dermatology provider or a facialist. And if you're comfortable with a topical retinoid, it works really well.
Great, thank you. Okay, so what about, so what's the impact of cheating with dairy foods on someone with low to moderate level dairy allergy? I guess the question is, if there's an allergy and you do a little bit, is that gonna, that's good.
Well, similarly with gluten, I have read or studied or learned somewhere along the way that, any cheat can last for 3 months, the inflammation.
Yeah, or I think even 6 months. It depends on like, if it's severe, probably 6. If it's mild to moderate, probably 3. But
tell patients we're not mad.
3 to 6. I mean, 6 is like, it's hard to imagine that sometimes, but I agree with you, Jessica. I mean, I do think, Judith, that unfortunately, if someone has a real allergy to something or sensitivity, I guess, depending on how you would look at that between IG and IgG, that's going to cause leaky gut and, gut permeability, gut inflammation. It'll lead to potentially systemic inflammation, which will then lead to skin issues. So I agree with you. I definitely, especially with dairy, we do find a lot of people's skin clears with going, casein free or dairy free, kind of thing. What are your thoughts about fluoride toxicity in acne? Going back to the acne, there, fluoride toxicity. That's interesting.
So it's never been mentioned in any traditional dermatology ever. Even in functional medicine training, I did all the advanced practice modules. They didn't mention skin with fluoride, to my knowledge. But I think that's the point here, is that we're trained that like your skin isn't connected to your gut.
Which doesn't make any sense, right? Yeah, exactly.
It's medicine's humbling. I mean, to be able to try to figure out how our intricate bodies. I mean, I think that traditional medical training is humbling. And then when you get to trying to understand the connectedness of everything, I find that when I get overwhelmed, we are not as smart as our bodies. We never will be. And our bodies are really smart to like really help find homeostasis and heal itself. So taking away things that get in our body's way is the smartest way to let our body heal itself. So in terms of toxicity, I don't know if you're more familiar with.
I mean, I do know that just from listening to different podcasts and stuff, that fluoride, there's fluoride expert on one podcast, I was talking about how there's research how fluoride will calcify the pineal gland, which is really bad, because that basically is the gland that produces melatonin, which you need for, if you think about, if you ask people, have you gotten your beauty sleep, right? Your skin glows in the morning and you're feeling much better after your sleep. But melatonin is the hormone that's going to help you with sleep onset. So if someone's pineal gland's getting calcified from fluoride, then they might not secrete enough melatonin to get the beauty rest to help the skin.
I thought I got impact on the thyroid as well. I'd never heard.
Fluoride does do that. Yeah, fluoride is is part of the halogen group in terms of the periodic table. So it's the same group as the I think it's the 7th type of element. So it's the bromide, the chloride, and the iodine. So it'll go into the iodine receptors, and it'll park in the iodine receptor, which will cause the thyroid to be underactive essentially. So, and there is evidence on fluoride and elevated TPO antibodies as well. So that could be a cause of Hashimoto's.
Sure. And then, low thyroid can cause dry skin. So, I mean, I find that the skin is often like an after effect of what's going on in other places in the body. So I'm sure that like fluoride toxicity is not good for skin in certain ways.
Yeah, most municipal, water supplies are contaminated with fluoride, or I shouldn't say contaminated probably, but they're they're laced with fluoride, we'll say. So yeah, you can use a water filter for that. I'm not sure if there's a way. That's a good question, Sarah. Yeah, no, we'll research that together. I don't know. I mean, there is research. There's a book that I have to get the name of it, but there is a book about fluoride that I think someone wrote on that. So thank you. Okay, so going back to, let's see, a lot of questions. I'm trying to figure out what Tony, thank you for that comment. So Tony, our health coach, was saying she uses coconut oil and castor oil to seal moisture in the skin, cleans the face 3 times a week, and oil washes the rest of the week.
Yeah, if it works for you. I mean,
mm-hmm.
The big buzzword that I like to tell people, because especially on commercial products, but even on like the more natural things, is that some are comedogenic and some are not. So the word to look up is it comedogenic? That means, does it cause acne? So, if you don't suffer from acne and your skin looks good,
it
and
doesn't matter. Yeah, not as much
for you. But if you're like somebody that struggles with acne, you want to make sure it's a non-comedogenic oil.
Right.
And if oily skin, you probably have to wash it more. I mean, the idea is balance in all of this. So,
yes.
If you're, you wash. And the same, patients ask me all the time, when do I moisturize? When you need it. So if you're dry, moisturize. If you're oily, don't.
Got it.
Oil is part of the...
So here's a question, good question from Michelle. What can I do to prevent flare-ups from HS? I think we talked about kind of treating the gut microbiome and also doing intermittent fasting would be one.
Loss is big.
Weight loss. What if someone's not like super overweight or something, or not overweight? Sure. Then would it still be a hormonal issue, or?
I would dig deeper into hormones.
Dig deeper. Sure. Okay.
But I would say that just for like the immediate relief, I have people come in for like Kenalog cortisone injections into the actual lesions if you have like a lesion.
Inflammation.
But typically, like, there's something fueling this inflammation. So, staying away from inflammatory foods, of course. Okay. And maybe even like, I would probably upgrade that person to maybe even like an autoimmune paleo.
Yeah, AIP. Okay, thank you. This is a good setup question for you. With toenail fungus, should a patient see a dermatologist or a podiatrist?
I vote for us. I mean, I find, I think it depends on like,
they should see a functional dermatologist. Yes.
See a good provider in any specialty.
Yes. Now we know that toenail fungus, from a functional perspective, as I'm sure you know as well, is a sign usually of systemic candida, right? You're going to be looking at, is that person eating too much sugar that's going to feed the candida? Sugar could be sugar. It could be excessive amounts of even grains, fruit, or anything that's high in carbohydrates that essentially will feed that candida. So I don't know, but what you normally do for our practice is we'll either treat with medications like fluconazole or antifungal herbs such as oregano, berberine, other things, just to help get, but it certainly is a nutritional issue as well.
Yeah. So the Institute for Functional Medicine has a great like anti-candida elimination diet. And then Saccharomyces boulardii is a good probiotic yeast. So I recommend that.
Absolutely.
I find just in traditional dermatology practice that I haven't prescribed an oral antifungal in years, because I find that it's hard on the liver, and 50% of the time it comes back anyway because we're not getting to the root cause. So I have like a target tissue, like nail topical that I use that works really well. It basically is like works as a sealant. So it's not probably very holistic, but just to get the nails looking better. It actually penetrates the nail bed because the nail plate, is porous.
Okay.
So the metaphor that I typically use is, if you have mold in your shower or mildew in your shower, and you just, like, let's say the fluconazole is like bleach. Well, if you just bleach the bath, but you feel it, it's going to come back.
It's
So
going to
this
come back. Yep.
topical,
Yep.
not, probably very clean, but it does crowd out the fungus and it actually prevents it from coming back without taking an oral antifungal. But
Got
I talk about sugar. Saccharomyces boulardii is a great probiotic.
Yeah, Saccharomyces, that's great. What supplements are proven helpful for extremely dry skin? From Julie there. Dry skin, I mean, fish oil or omega-3s, like fish oil, algae oil is something I would think about, but certainly you'll also have to think about, Julie, like Jessica said here, about some of the root causes might be even like thyroid issues, or vitamin A, I guess, could be too, those type of things.
Yes, I think that there is an element of what skin you're born with, and you're either dry skin or you have oily skin, and that's
right.
the mechanism in the actual target tissue. So it may be that you're doing anything wrong. It may just be that you tend to be drier. So if somebody has dry skin in and of itself, again, I wouldn't overwash. I wouldn't use hot water. I say, like, put a space heater in the bathroom so you don't, like, you're not freezing and trying to, like, fry your skin with the hot water. But I think there's a difference between dry skin that needs a little bit more emollient and barrier attention, and rashes to me means systemic inflammation, or it could be like a contact allergen. But that means that there's more beyond the target tissue, versus dry skin may just be that your skin just tends to be.
Do you like aloe vera gel? I've been reading about that for skin health. Is that?
Yeah, but anything that's good for, like, healing the gut. So again, if it's gonna heal inflammation and leakiness of the gut, I think it's going to have a similar impact on the skin. If it's an inflammatory issue that is coming from gut inflammation, if it's just that barrier is dry, a lot of times it's just use and avoiding hot water.
So just a point, thank you, Jessica. Just a point before we get to the next question. We've talked about skin, gut, skin hormones a little bit, and then I just wanted to say that there's also the skin immune connection. There's immune cells in the skin. And so we talk about, during COVID now with, it's really important to have a healthy immune system. One of the biggest parts of your immune system is your skin, having a healthy skin barrier, something that's working can be indicative. So when you're looking at your own skin here, as we're, on Zoom here, you can look at your skin and you can look at lab tests, look at how's your health. You can get a physical exam, how's your health, all these different aspects. But looking at your skin, literally, that could be a window into your health. Is that right?
Absolutely. And then, viral exanthems or rashes that come with viral illness. I mean, some COVID cases have been diagnosed just by, like, certain clues on the skin. There was a whole thing going around about COVID toes and, I find that especially kids, they, not necessarily with COVID because we don't know enough about it, in real time, but when they get sick, often it shows up on their skin. And so it can be a clue, if there's a rash and there was a fever or just feel some malaise or that kind of thing. But similar to the dry skin comment, I mean, I think that vitamin D, vitamin E would also be effective, but you want to do immune support for sure. But barrier issues, again, there's systemic and then there's the target tissue. I tell people all the time, like, if they have warts or molluscum or like a viral topical infection, if the barrier is broken and there's like cracks in the skin, or it's not, that barrier isn't intact, you're more open to infection. But with viral things, you can see all sorts of, I actually had COVID in March and I had this kind of like reticular, like lividoid, strange, splotchy rash. So, when your body's fighting something, of course, there's going to be signs and signals, just kind of waving that alarm or sounding that alarm that something's going on. It can be a clue for sure.
Great. Going to just on that topic for one more thing, rash under the earlobes related to mask wearing, since we're talking about COVID now, just a little bit.
I really would want to know what kind of rash. So is it like bumpy, red, itchy? The itchier it is, the more likely that contact dermatitis.
Contact, yeah.
Allergy. If it's like scaly, red, patchy, not that itchy, I would think more like fungal.
Fungal, okay.
you know, maybe like it depending on, I would ask a lot of more questions about like the situation the person's in, like if they're wearing a mask all the time and they're sweaty, or maybe they don't wash behind their ears that much and now there's something always sitting there, or they're using the same mask and not washing
She said it's white, scaly, and itchy.
behind the ears.
Behind the ears, yeah. I want psoriasis, maybe. I wonder if that's. I guess it could be contact. Wouldn't be under the ears. Under the ears, okay.
Under the ears, so like on like the jawline.
This is where it might be something where you might want to see a dermatologist in person. It might be hard to know for sure.
I mean, white scaly, no redness makes me think either dry skin or
yeah.
Maybe even like some, it depends, because most like infectious things would be red.
Yeah.
White scale can be, depending on that area, doesn't typically, could be just dry skin.
Dry, yeah. If it's, I wonder, trying some lotion before putting on the mask or something. Another question, yeah.
Or anything. Aquaphor, just like
Aquaphor, yeah.
Yeah, eyelid dermatitis.
Nice. Yeah. Okay, that's good. Yeah, Aquaphor's good. Acne and mask wearing. Does mask wearing cause acne or exacerbate acne, I guess?
I think it can. There's a product that's out there that I prescribe that actually is, you can spray the mask and then you can spray the face. So it's actually treating, the mask, because I mean, anytime that it's hot, humid, if it makes it more oily, or if there's pathogens, either from breathing into the mask or, I mean, definitely washing your face if you're wearing the mask for a long time helps a lot. But I think that you're going to have more microbial issues on the surface of the skin when you're covered than, our typical environment. So increase of acne with mask wearing, and everyone's different. Some people are fine. Some people are really struggling with it.
Yes, thank you. So we have about 10 minutes left. We have a lot of questions here. Thank you for all the questions. These are great questions. Thank you for giving all these questions. Also, there's so much to talk about with skin and dermatology, and you can see how on this discussion here that it's all connected, right? Everything's connected.
Yeah.
Let me see if we can try to get to. Okay, there's a connection between eczema. Oh, there's a lot of questions. Okay. I guess we can go back to, let's do this one, because what is the root cause of hyperpigmentation? What's the best way to address that?
So hyperpigmentation is just a blanket term for like increased pigmentation. One of the most common causes is post-inflammatory hyperpigmentation. So I explained to patients, PIH means that there was some inflammatory event, whether it's a bug bite, a pimple, a scratch, a scrape.
Okay,
if you're darker skin, you have more melanin in your skin, you're more prone to that. So the treatment would be to get to the root cause of the inflammation. So if it's, acne or rashes, or I've even seen, especially in like African-American patients, like if they're chronically dry, the inflammation from being dry all winter shows up as dark patches by the end of that season. So
dry skin could be causing inflammation itself.
It can, yeah.
Yeah.
So post-inflammatory hyperpigmentation is typically from an inflammatory event of some sort. And you don't think of dry skin as being causing darkness, but it can. But they may be talking more about either it could be sun-induced, like sun damage. So lasers and chemical peels and retinoids can do a good job of like lifting sun damage, and avoiding sun, wearing sunscreen can prevent like just that type of hyperpigmentation. Or then of course there's like hormone mediated ones like melasma.
Okay, right.
And melasma is tough because it's kind of like estrogen mediated. So patients on birth control pills. Or, again, you get into that quagmire of hormones.
Right. Let's talk about, so is dry skin, this is another dry skin question from Jessica. Another Jessica, not you, Jessica. Is dry skin... Is dry skin accompanied by reddish or purplish color related to skin health, or more related to tissue health or circulation? You definitely want to rule out circulation there for sure, especially if someone has a cooler, cold circulation, that kind of thing. Raynaud's might be another consideration. But what do you think about that? Yeah.
I mean, just words that's confusing, because like if it's on the lower legs, that's different than if it's on the hands or on the face. The lower legs have, there's like stasis dermatitis, and the lower legs are quite dry anyway. So especially in older patients, I would think more of that, but it
Yeah.
depends on what body.
Venous stasis, if it's in the medial, if it's on the inside part of the leg near the ankle bone, you think about venous stasis, more like leaky veins, I think. But yeah, that you would definitely go see a practitioner about that. Get that examined.
Yeah, somewhere in the body, because then I would need
Mm-hmm.
to that or have a little more details. But
Yeah,
it can't
yeah.
be the lower leg. The stasis. Look up stasis dermatitis if it's the lower leg, especially in
Okay.
an older patient.
Thank you. Jade asks, related to eczema, what are ways to strengthen the skin barrier? Another, I think, talking about leaky skin and just ways to, I guess you said moisturizers and reduce inflammation, of course, things.
I do believe that there is such a thing as some people's barriers are drier and need
Okay.
more support. And I don't know if you can like fix that. So I think if you tend to have dry skin, to my knowledge, I mean, of course, like there's things that exacerbate it, but I think that the barrier needs attention. So in dry months, like emollient use and avoiding hot water is a big one. I keep saying it. But to my knowledge, I don't really, I think even healing, like going to root cause, I don't know if that's going to change the fact that your skin apparatus just tends to have a barrier issue. And I think that can be genetic. I think it can be inflamed and exacerbated by inflammation and other triggers, but the actual tissue might just struggle and need a little extra support.
Okay, what causes depigmentation? That's the opposite, other than vitiligo. The vitiligo being an autoimmune condition where there's hypopigmentation, where there's a lighter skin versus the usual melanin amount in the skin. What causes depigmentation?
Well,
and then hair loss is, well, I don't get to hair loss before one. So
yeah, hair loss is tough.
It's big, yeah.
I mean, I would say vitiligo is depigmentation. I mean, it's literally, you can take a Woods lamp, which is like a black light, and if you're a patient, put it under, without any light in the room, it will look like a white t-shirt and a black light. So really depigmentation is, I would say, really one of the only causes is vitiligo. I mean, scars can be depigmented but typically they have some sort of coloration to them, but more hypopigmentation or decreased pigmentation typically happens after inflammation. So just like inflammation can cause darkness, it can actually cause lighter pigmentation as well. So there's something called like pityriasis alba on the face, especially in Hispanic children. When they get like real dry, they get this like splotchy white patchiness on their skin, or tinea versicolor is like a fungal rash in the summer. When it clears and the rash is actually gone, it kind of like the inflammation crowds out the pigment cells, and then you can have depigmented little patches, typically on like the chest and back or on the trunk. But that's what comes to mind there.
Okay,
crowd out pigment cells.
Got it.
Pigmentation.
Stephanie was asking, this is back to the fungal sealant that you had. What's the name of that? She's our nurse practitioner here.
It's a prescription called Nuvail. I get it from like a specialty pharmacy. They may have some pharmacy in Maryland. I don't think they do. I think I asked when we were chatting once, but you want to look for like a dermatology specialty pharmacy, or you can contact the company Nuvail. It's great.
Okay. So a lot of questions today. I think we want to get to hair loss. Love to have you back sometime for another round of this, because there's so many questions about derm, and thank you so much for coming on here, Jessica. And what do you think about hair loss? That's another big topic, of course. We could probably spend a whole hour on hair loss, but what are your general thoughts about hair loss and how to help that?
Hair loss is tough. If someone comes in, I first try to figure out what category we're in. So if it's just genetic, hormone mediated, like an androgenic alopecia, which happens and that can be male and female. But if you have thinning that runs in the family and that's how you respond to your hormones, that can be addressed with Rogaine. Rogaine helps the follicle stay active so that, and even with something transient like Telogen Effluvium. So Telogen Effluvium is, I always say it's not like just in the cartoons that, when you get stressed out, your hair falls out. So a stressful event, a surgery, a trauma, a nutritional deficiency, typically, if that's corrected with time between 6 and 18 months, the hair should cycle back. But Rogaine can really help preserve the follicle so it doesn't die. So you get the full, that's all we have right now in terms of like the target tissue to preserve the follicle. So we do PRP here where I draw the blood, spin it, and the platelet-rich plasma. Injections can induce hair growth, but I never recommend it if people aren't on Rogaine because it's like watering soil that has no seeds. So those are the two most common, but getting to the root cause, it can be all over the map. I mean, I do like a hormone panel. I do a vitamin and mineral panel. I check the thyroid is a big one. But there are other more rare causes of hair loss or scarring hair loss. So an examination to see if there's something else going on, especially just typically conventional hair care does not cause hair loss. One of the biggest misconceptions is that washing your hair makes it fall out. So I always have to reassure people, you will see it more when you wash and style your hair, but it will release from the scalp whether you wash it or not. So getting to the root cause, I tell patients, just looking at you, I don't know if you're vitamin D deficient necessarily, or, there could be something going on with your thyroid, or there could be zinc deficiencies or other vitamins and minerals. So I usually start with a blood panel.
Thank you. One really quick question. What is the name of the acne mask spray? Do you?
So that's
prescription. Okay.
Spray. So hypochlorous acid. I have heard that hypochlorous acid is available on Amazon.
Okay.
But I tell them to use it as an acne treatment. It's great for bacne because you can spray it. It's easier to apply, and then you can spray them.
Although we don't recommend either supplements or meds on Amazon just because it's not a controlled environment, really. But,
but it's if you can't get the prescription.
Yes, got it.
You can spray the mask for your face.
It's 1 o'clock, so we probably have to sign off here. But thank you so much, Jessica, for coming on, and really would love to have you back for a second round of this. Curious if people are interested in like a gut skin class. I think that would be really a good, so if you are, just type yes in the box or something if you're interested, because you'd definitely be doing that for sure. Thank you so much for attending, everyone. And Jessica, great to see you here, and we'll see you again soon. Thank you so much.
Thanks for having me.
Okay, see you.
Bye, have a good day.
Bye.
Stay safe.
You.